Welcome to the deep dive. So today we're focusing on something that really impacts quality of life for, well, millions globally, but it's often misunderstood.
Tinnitus.
Yeah, and when people hear tinnitus, they usually just think, ringing, a high-pitched sound.
Right.
But the research we looked at shows it's a whole range of sounds. Buzzing, hissing, even chirping or whistling.
Roaring, humming, clicking, whooshing.
Exactly. And in some extremely rare cases, people even perceive music that isn't there.
The basic idea is simple, right? Hearing a sound when there's no actual external sound source?
Pretty much.
Yeah.
But the scale, it's huge.
Yeah, how common is it?
Well, in the US alone, we're talking over 25 million adults. It's one of the most common health complaints.
Wow.
And yeah, for many, it's maybe just annoying background noise. But the sources stress that for about 5 million people, it's what they call burdensome chronic tinnitus.
Burdensome meaning it genuinely disrupts their life. It interferes with sleep, with concentration, their emotional state. So our goal here is really to understand, first, what's causing this phantom sound, and second, how can you manage it? How can you essentially get your brain to tune it out?
And that second part, that's often the real challenge, isn't it? Because it seems like the sound gets louder exactly when you don't want it to.
Right, when things are quiet, you're trying to sleep, trying to focus, that's when it often becomes most noticeable.
Okay, so where do we start? How do we categorize this?
Well, first up is understanding there are two main types. And the vast majority, over 99%, is subjective tinnitus.
Subjective meaning only I can hear it.
Exactly. Perceivable only to the patient. And this is typically a neurological thing, a reaction to some kind of hearing damage or loss.
So my brain is kind of generating the sound internally because of some underlying issue.
That's the main theory, yes. Now, the other type is objective tinnitus. This is incredibly rare, less than 1% of cases.
And objective means?
It means someone else can actually hear it, usually with a stethoscope. It's often produced by real physical processes inside the body, like blood flow issues or muscle movements near the ear.
Okay, that distinction is helpful. Subjective versus objective. But before we really dive into the causes of the common subjective type, there was a pretty serious medical warning in the sources about pulsatile tinnitus.
Yes, absolutely critical to mention. Pulsatile tinnitus is different because the sound isn't constant, it's rhythmic.
Wow.
Usually a whooshing or thumping sound.
That beats in time with your heart.
Precisely, in sync with your heartbeat. And the experts are really clear. This specific type is a major red flag.
Why is that?
Because it often points to a potentially serious issue with blood vessels near the ear. Could be high blood pressure, could even be a vascular tumor. So if you experience that kind of rhythmic sound, you need to see your doctor immediately. That's not one to ignore.
Okay, that's vital information. So setting that specific warning aside, let's go back to the much more common subjective tinnitus. You mentioned it's linked to hearing loss.
Deeply linked, yes. Though it's important to say, tinnitus doesn't cause hearing loss, and hearing loss doesn't automatically cause tinnitus. They're just very often associated.
So what's the connection then?
The leading theory is kind of like phantom limb, but for hearing. Imagine there's damage to the tiny hair cells in your inner ear, the cochlea, maybe at certain sound frequencies. The brain notices this lack of input. It registers silence where there should be sound. So the auditory part of the brain tries to compensate. It turns up its own internal gain or volume.
Trying to hear the missing frequencies.
Sort of. And in doing so, it starts perceiving sounds that aren't actually coming from the outside. It's the brain trying to fill the gap, but in a way that unfortunately creates this phantom noise.
Wow, okay. The brain trying to help, but actually making things noisy. Does that oversensitivity, that gain being turned up, relate to another condition mentioned, hyperacusis?
It definitely seems related. Hyperacusis is where everyday sounds that wouldn't bother most people, become intensely loud or even painful for someone with tinnitus.
So not only do you have the internal noise, but external sounds become overwhelming too.
Exactly. It suggests the whole auditory system is kind of on high alert, hypervigilant. People with hyperacusis often find themselves needing to muffle sounds or avoid noisy places just to cope.
Okay, so if the root is often the brain reacting to some kind of damage or imbalance, let's move into section 2 and really unpack the wide range of things that can cause that initial problem. It's not just loud rock concerts, is it?
No, definitely not. Although noise exposure is the big one. The sources suggest up to 90% of people with tinnitus also have some level of noise-induced hearing loss.
90%, that's huge.
It is, and it can be from long-term exposure, think carpenters, pilots, musicians, construction workers.
A landscaper's using loud equipment.
Right. Or it can be from a single extremely loud event, like a gunshot or an explosion close by. That can permanently damage those delicate cells in the cochlea.
Okay, so noise is a major factor, but what else? The sources mentioned some surprising triggers.
Yes, this is where it gets interesting. We need to talk about medications, specifically ototoxic medication.
Ototoxic meaning harmful to the ear.
Exactly. The research points to over 200 prescription and non-prescription drugs that can potentially cause or worsen tinnitus.
200? Seriously? Like what?
Well, some really common ones stood out. Things like aspirin, ibuprofen, naproxen, your everyday pain relievers, especially at high doses or if taken for a long time.
Wow, okay.
Then you have certain types of antibiotics, loop diuretics used for blood pressure, some antidepressants, and quite a few chemotherapy drugs.
So is the effect always permanent?
Not always. That's the crucial thing. For some drugs, the tinnitus might start when you take it and stop when you stop the medication. It's temporary. But for others, unfortunately, the damage can be permanent.
Which means talking to your doctor about all your medications is really important if you have tinnitus.
Absolutely essential. A thorough medication review is key.
Okay, so we have noise, we have medications. What about like physical things, blockages or injuries?
Yeah, definitely. Simple things like excessive earwax buildup can block the ear canal and trigger tinnitus. Same with sinus infections or ear infections. The pressure change can cause it.
Makes sense.
And then there are injuries. Head or neck injuries can sometimes affect the nerves or blood flow related to hearing.
And I remember reading specifically about jaw problems.
Yes, TMJ syndrome, temporomandibular joint issues. That's the hinge connecting your jawbone to your skull. Problems there can sometimes affect nerves or muscles near the auditory system and either cause tinnitus or make it worse.
Okay. And finally, the sources listed quite a few underlying health conditions where tinnitus is basically a symptom.
Right. It can be a sign of something else going on in the body. High blood pressure is a common one.
How does high blood pressure cause ringing?
Well, it's often more of a whooshing or humming sound in that case. Increased blood pressure can make the sound of blood flowing through vessels near the ear more turbulent and audible. Then you have other conditions: cardiovascular disease, diabetes, thyroid problems, autoimmune issues like lupus or rheumatoid arthritis, even anemia or low vitamin levels. Meniere's disease, which affects the inner ear directly, is another big one. Otosclerosis, too.
So tinnitus can really be a signal from anywhere in the body, almost.
It underlines why getting a proper diagnosis involves both an audiologist, for the hearing aspect, and your primary care doctor to look at the bigger picture.
Right. And quickly, before we talk about managing it, what about things that don't necessarily cause it but make existing tinnitus worse?
Oh yeah, several things. More loud noise exposure is a definite no-no, but also lifestyle factors. Smoking is a big one. It narrows blood vessels, which can affect the ear.
Alcohol, caffeine.
Excessive alcohol, yes. Caffeine can be a trigger for some people, and a really significant factor is stress and fatigue.
So when you're stressed or tired, the ringing gets louder.
Very often, yes, there's a strong correlation. Managing stress is actually a key part of managing tinnitus for many people.
Okay, so let's pivot to that management. Because the experts seem pretty clear. For most chronic subjective cases, there isn't really a cure in the traditional sense.
That's the reality for most people, yes. So the focus shifts entirely from curing it to managing it, making it less noticeable, less bothersome.
So what are the approaches? I guess first, dealing with any obvious treatable causes.
Exactly. Step one is always, can we fix an underlying issue? Getting earwax removed professionally, not with cotton swabs.
Right.
Or working with your doctor to adjust a medication if it's suspected to be ototoxic. Managing blood pressure, treating an infection. If there's a direct cause you can treat, that's the first path.
But for the cases where it's likely permanent, neurological, what then?
Then we move into management strategies. One major tool, especially if there's accompanying hearing loss, is hearing aids.
How do hearing aids help with ringing?
By amplifying the external sounds you need to hear. They bring in more real sound information from the environment. This gives the brain more to focus on, making the internal tinnitus sound less prominent. It reduces that contrast.
Okay, makes sense. What else?
Sound maskers are another common approach. These can be small devices worn in the ear, similar to hearing aids, that produce a constant low-level sound, like white noise.
To kind of cover up the tinnitus.
Essentially, yes. Or people might use tabletop white noise machines, especially at night, to help them ignore the ringing and fall asleep.
So technological aids are one part. But the sources really emphasize the psychological aspect, how you react to the sound.
Absolutely crucial, because often when tinnitus starts, the brain flags it as important, maybe even dangerous. This loud, intrusive noise, it triggers a stress response.
Fear, anxiety, anger.
Exactly. And that stress response, as we said, can actually make the tinnitus seem worse. It becomes a vicious cycle.
So how do you break that cycle?
This is where therapies like cognitive behavioral therapy, or CBT, come in. CBT doesn't make the sound go away, but it helps you change your reaction to it.
Learning to not see it as a threat.
Precisely. Reframing it from a danger signal to, well, just a neutral sound. An annoyance, maybe, but not something to fear. And alongside CBT, relaxation techniques are vital. Yoga, biofeedback, mindfulness, regular exercise. Anything that reduces overall stress can help lessen the perceived intensity of the tinnitus.
Okay, this leads us to what seems like the core strategy for long-term management. Habituation.
Yes, habituation is the ultimate goal for many people with chronic tinnitus.
And the idea is basically training your brain to ignore the sound, like how you eventually stop noticing the hum of a refrigerator.
That's a great analogy. It's getting your brain to classify the tinnitus sound as unimportant, as benign background noise, just like you filter out the sound of traffic if you live near a busy road or, the fridge humming.
Your brain learns it's not a threat, it's constant, so it just stops paying attention.
Exactly. It gets filtered out by your subconscious auditory processing before it even reaches your conscious awareness, or at least its impact is significantly reduced.
So how do you actively train your brain to do that? Is there a specific method?
There is. It's often called tinnitus retraining therapy, or TRT. It's usually a longer-term approach, maybe 6 to 18 months.
And what does TRT involve?
It typically has two main components. First, there's in-depth counseling. This focuses on educating the patient about tinnitus, explaining what it is, and crucially, what it isn't, i.e. it's not dangerous, it doesn't mean you're going deaf. Demystifying it helps reduce the fear.
Okay, de-threatening the sound.
Right. And the second part is sound therapy, or sound habituation. This often involves using a device that generates a constant, low-level neutral sound like broadband noise or nature sounds worn for many hours a day.
So you're adding sound. That seems counterintuitive.
It does, but the sound is set at a level below the tinnitus, or just mixing with it. The goal isn't to mask the tinnitus completely, but to give the brain this constant neutral stimulus to get used to. Over time, the brain learns to filter out both the external neutral sound and the internal tinnitus sound as irrelevant.
Wow. So it's really about changing the brain's filtering mechanism.
It's about retraining the auditory pathways.
So the practical advice then, alongside therapies like TRT or CBT, seems to be change your mindset.
Yeah.
Stop focusing on the sound.
That's a huge part of it. The sources advise things like keep busy, engage in activities you enjoy, try to normalize your life as much as possible, avoid constantly monitoring the tinnitus. Is it louder today? Is it quieter?
Because that just keeps your brain focused on it.
Exactly. It reinforces the idea that the sound is important and needs attention. And also avoid constantly searching for miracle cures online, which often just increases anxiety. The key is acceptance and focusing on letting the habituation process happen naturally.
Okay, let's try to quickly summarize this deep dive then. Tinnitus is hearing a sound could be ringing, buzzing, whooshing when there's no external source.
Right. And while it can be incredibly disruptive, it's usually a neurological reaction, often linked to some kind of hearing damage or change. It's generally not dangerous in itself, aside from that specific pulsatile warning we gave.
And management is definitely possible, either by treating an underlying cause, if one can be found,
like earwax or a medication issue, or for chronic cases by using strategies like hearing aids, sound maskers, and crucially psychological approaches like CBT and habituation therapies like TRT to help the brain filter out the sound.
And for listeners, what about prevention? How can people protect their hearing to hopefully avoid this in the first place?
Prevention is key. The advice is pretty straightforward. Wear hearing protection, like earplugs or earmuffs, whenever you're exposed to sounds over 85 decibels.
Which includes things like
lawnmowers, power tools, chainsaws, concerts, loud sporting events, even noisy workplaces.
And what about headphones or earbuds? That's a big source of noise exposure for many people now.
Yeah, a really important point. If you use headphones, try noise-canceling ones as they let you listen comfortably at a lower volume. Keep the volume well below, say, 80% of the maximum.
And limit listening time.
Definitely. Don't listen continuously for hours. The recommendation is often no more than 90 minutes at a time without a break. And just generally, in noisy environments, try to take regular quiet breaks to give your ears a rest.
It really is amazing when you think about the brain's ability to filter things. We walk through a city, and our brain just cancels out so much background noise so we can focus.
It's incredibly powerful, that subconscious filtering.
So if we can actually train our brains through therapies like TRT to filter out even a persistent internal phantom noise, well, it makes you wonder about the potential we have to consciously or subconsciously shape our own perception of reality, doesn't it?
It does raise fascinating questions about neuroplasticity and perception, but maybe bringing it back to a very practical step. If you, the listener, suspect you have tinnitus, what should you do?
What's the first step?
Talk to your doctor or an audiologist. Get your hearing checked. And the sources suggest asking specific questions.
Like?
Ask, does having tinnitus mean I definitely have hearing loss? Get clarity on that association. And also ask, based on my health and history, what could be causing my tinnitus? Explore potential triggers like medications, blood pressure, or other health issues.
So information is the starting point.
Always. Understanding what you're dealing with is the first step toward managing it effectively.